everybody. My name is Maureen Crane, and thank you for taking a few minutes to watch this video discussing the Medicaid coverage gap and broader issues of health access and equity, an issue that affects millions of people across the United States but often goes unnoticed. This is a critical issue throughout the United States, and where you live should not determine whether you can see a doctor, manage a chronic illness, or receive mental health care. However, for many low-income adults, this is their reality. So, what is the Medicaid coverage gap? Well, the Medicaid coverage gap exists in states that have not expanded Medicaid under the Affordable Care Act. In these states, adults may earn too much to qualify for traditional Medicaid but make too little to afford private insurance or qualify um, for different health insurances on the marketplace. As a result, these individuals are completely uninsured. For example, a single person in Texas who only makes $10,000 a year does not qualify for Medicaid, even though purchasing health insurance would cost more than half their salary. This is not a small problem. With over a million adults nationwide falling into this gap, many of whom are working, raising families, and managing ongoing health conditions. As stated, while the number of people in the coverage gap has declined as more states have implemented the expansion, 1.4 million uninsured individuals remain in the coverage gap in the 10 states that have not expanded Medicaid. Without insurance, people are more likely to delay preventive care, skip medications, and rely on emergency rooms for basic health needs. This can lead to worse health outcomes and higher costs for individuals, hospitals, and communities overall. Who is affected by this? The people most affected by the coverage gap are low-income adults, families, workers, people of color, rural residents, and individuals with chronic or mental health conditions. As stated, 60% of individuals in the coverage gap are people of color, and more than 550,000 essential workers fall into the Medicaid coverage gap. These groups already face systematic barriers to healthcare, and the lack of insurance compounds those challenges. When people cannot access care that they need, it doesn't just impact their health, but it also impacts their ability to work, care for their families, and contribute to their communities. Health and equity ultimately weakens the entire healthcare system overall. Current policy overview regarding the Affordable Health Care Act gave states the option to expand Medicaid to adults earning up to 138% of the federal poverty level, with the federal government covering most of the cost. According to Norris 2026, as of early 2026, 10 states had not expanded Medicaid, with a coverage gap of 9 of them, including Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, and Wyoming, as well as Wisconsin, which partially expanded Medicaid. In states that adopted expansion, uninsured rates dropped significantly and access to care improved. However, because Medicaid expansion is optional, residents in non expansion states remain uninsured simply because of where they live. A recommended policy solution to address this issue, I fully do support expanding Medicaid in all states, or at least creating a federal fallback coverage option for states that choose not to expand. This would close the coverage gap, ensuring that access to healthcare is based on need rather than where you live. As stated, approximately 2.7 million uninsured adults would gain coverage if all states adopted Medicaid expansion, including the 1.4 million people in the coverage gap and the 1.3 million uninsured adults. Research shows that Medicaid expansion improves health outcomes, reduces medical debt, and lowers uncompensated care costs for hospitals. Community action advocacy, it's really important to note that policy change does not happen without public pressure and community engagement. That is why advocacy, especially for issues like this that affect literally millions of different people, that's why advocacy for these issues is so important. Communities members can share their stories, contact state legislators, attend town halls, and support organizations working toward health equity. Even small actions such as sharing information on social media, talking to friends or family, can definitely help raise awareness and shift public attitudes towards this issue. As a call to action, I encourage you all to get involved by learning whether your state has expanded Medicaid, contacting your representatives to express support for expansion, and engaging with local health advocacy organizations. Healthcare is not a privilege, it is a necessity, and together we can advocate for policies that promote dignity, equity, and access for all. I would like to just say thank you guys for taking the time to listen and learn more about this critical issue. Advocacy begins with awareness, and your voice matters. By working together, we can help close the Medicaid coverage gap and create healthier and more equitable communities. Thank you.